Hello, this will be a training and overview on person-centered practices. What we do. The Department of Healthcare Policy and Financing administers Health First Colorado, which is Colorado's Medicaid program, Child Health Plan Plus, and other healthcare programs for Coloradans who qualify. Our mission, improving healthcare equity, access, and outcomes for the people we serve, while saving Coloradans money on healthcare and driving value for Colorado. What are person-centered practices? Provider agencies who follow person-centered practices focus on what matters most to the person receiving their services. Person-centered practices involve listening to the person's needs, preferences, and goals, and supporting members in making choices about their own life and care. What does person-centered support look like? It looks like thinking and behaving in ways that respect and value individual preferences, strengths, and contributions. It's working with members and families, not doing things to or for them. Lastly, it supports people in having positive control over the life they desire and find satisfying. A core concept of person-centered practices involves finding the balance between what's important to the member and what's important for the member. Factors that might be important to the member you're working with might include things like their preferred people and relationships, the status or control over different aspects of their life, the rituals and routines they prefer, and their rhythm or pace of life. And examples of how a member might choose to exercise these preferences could include things like practicing preferred sleep and wake times, using preferred hygiene items, and spending time with pets or friends. Factors that might be important for the member you're working with could include things like illness prevention or treatment, safety, functional support, medical needs, or following a prescribed plan. And examples of how a member might choose or need to exercise these include things like wearing a helmet, ensuring a clean environment, attending counseling, or managing diabetes through diet. Here are some examples for what finding the balance as provider agencies might look like. It might look like scheduling meetings according to the environment, pacing, timing, and attendees the member prefers. It could look like presenting a choice of the preferred foods that fit within dietary restrictions, or adjusting a medication schedule to match the preferred routine or sleeping schedule of the member. And lastly, finding that balance could be providing safety equipment and measures for the member to participate in desired trips or community activities. Balancing important twos and important fours ensures person-centered supports and care that respects autonomy while managing risks. Practicing person-centered care involves looking and listening differently so you may understand the member more fully. Some examples of looking differently include paying attention to nonverbal cues that indicate comfort, alertness, and understanding, and focusing on the whole person, not just their diagnoses and needs. Lastly, looking differently could be identifying strengths, capabilities, and preferences. Listening differently could be using open-ended questions, listening for the member's values and goals. It could be empathizing and validating what the member says. And listening differently could be focusing on the emotions and intentions behind the word, rather than just gathering facts. And then once a provider agency is able to look differently and listen differently, they can understand more fully, and that could be involving the member in decision-making, establishing a plan that the member and care team can support, actively seeking member feedback, and allowing for a flexible care plan that can be adapted as needs or as preferences change. Implementation of person-centered practices. Providers can provide a promise to listen to what is said and what is meant. It can mean a promise to act on what providers hear, identifying something providers can do right away, or keep acting on what is heard throughout the process. And lastly, it includes a promise to be honest. Providers can identify when requests will take time or when they don't know how to help, and providers can communicate when what the member is saying conflicts with staying healthy or safe. Do you want more information? You or someone on your team can register for the CO Train Person-Centered Training Series at this link. Also, if you have questions about the training platform or resources, you can send an email to hicpuff_cmatraining@state.co.us. Lastly, it's important to know that all of the embedded website links within this training will be accessible and available in the posted version of this slide deck. Thank you for watching.